It almost sounds like wellness clickbait. Walking fast is as powerful as medication. But behind the headline-worthy phrasing lies a serious and growing body of research that's making doctors take a second look at one of the simplest, oldest, most accessible forms of movement known to humans. The case is mounting that brisk walking, yes, just walking, but faster than a dawdle, can rival prescription drugs when it comes to controlling major health conditions like high blood pressure, high cholesterol, and type 2 diabetes. And unlike a pill, walking won't give you dry mouth, joint pain, or a mystery rash you have to Google at 2 a.m. Let's start with blood pressure. Numerous studies, including data from the British Journal of Sports Medicine, show that regular brisk walking can lower systolic and diastolic blood pressure significantly, often to levels comparable with standard antihypertensive medications. A meta-analysis comparing exercise interventions to drug trials found that for people with elevated blood pressure, aerobic exercise like brisk walking was just as effective at bringing numbers down, especially when practiced consistently over time. It's not magic. It's biology. Walking improves arterial elasticity, boosts nitric oxide production, which helps blood vessels relax, and reduces sympathetic nervous system overdrive, all of which help keep blood pressure in a healthier range. Then there's blood sugar. Brisk walking improves insulin sensitivity, your body's ability to use insulin efficiently, and helps move glucose out of your bloodstream and into your muscles. Even short post-meal walks can significantly blunt blood sugar spikes, a fact that's been repeatedly confirmed in clinical trials. In one standout study, older adults who walked briskly for just 15 minutes after each meal had better glucose control than those who took one longer walk per day. In many cases, these modest efforts performed as well or better than oral medications for early-stage type 2 diabetes. And the side effects? A little sweat and maybe a slightly smug feeling of superiority. When it comes to cholesterol, brisk walking once again delivers a quietly powerful punch. It nudges LDL, bad cholesterol, down and HDL, good cholesterol, up, while improving lipid particle size, a technical way of saying it helps make cholesterol less dangerous in the bloodstream. These changes, again, are on par with what's seen in patients taking statins or other lipid-lowering agents, especially when walking is done regularly and at a pace that gets the heart working. You don't have to run a marathon. You just have to walk like you mean it. What makes this even more exciting is how well walking stacks up holistically. Unlike medications that target a single biomarker, walking improves multiple systems at once. It benefits the cardiovascular system, the metabolic system, the immune system, the brain. And instead of causing side effects, it reduces them, like anxiety, brain fog, insomnia, and chronic inflammation. No copay, no pharmacy wait time, no list of warnings that ends with, in rare cases, death. Of course, this isn't about throwing your medications in the trash and marching into the sunset with a Fitbit and a dream. For many people, especially those with more advanced conditions or genetic risks, medication is essential. But what the science is increasingly saying is that brisk walking can be a legitimate therapeutic partner, and in some cases, even a first-line treatment. Particularly in early-stage hypertension, prediabetes, and mild hyperlipidemia, doctors are starting to prescribe movement before pills. It's prevention disguised as daily habit. The biggest barrier? It's not science, it's psychology. People tend to underestimate walking because it seems too simple, too ordinary. We associate effectiveness with effort, complexity, and sometimes cost. But brisk walking flies in the face of all that. It's free. It's accessible. And when done regularly at a moderate intensity, it literally changes the chemistry of your body. So yes, walking fast can be as powerful as medication for the right person at the right time with the right consistency. It's not just exercise. It's a prescription with no fine print, no scary side effects, and a built-in upgrade to your mood, your metabolism, and your lifespan. Your doctor might not have written it on a pad, but your feet already know the way.